Kieran Cooper's liver transplant story is receiving new attention after the 25-year-old revealed that severe jaundice turned his skin and the whites of his eyes an intense yellow before he underwent a second transplant on February 28, 2026. Cooper says his color has since returned to normal and that he is recovering, attending hospital appointments every 6 weeks and taking lifelong medication. But one critical detail remains unexplained in the public reporting. What exactly caused the liver he received as a baby to fail more than 2 decades later? For verified entertainment and human interest updates without the rumors, subscribe to Startline Entertainment. Cooper is from Northwich in Cheshire, England, and his medical history began almost immediately after birth. According to his public account, he became yellow when he was only 2 days old and was diagnosed with biliary atresia. Although some reports summarize the condition as a problem in which the gallbladder does not form correctly, specialist medical guidance describes it more precisely as a rare disease in which a newborn's bile ducts are missing, incomplete, damaged, or blocked. That prevents bile from moving normally out of the liver, allowing it to accumulate and injure liver tissue. The distinction matters because biliary atresia is not an illness Cooper developed at age 25. It is a condition that appears in infancy, and its consequences can continue throughout a person's life. Liver UK estimates that it occurs in approximately 1 in 10,000 to 1 in 20,000 births in the United Kingdom. Early signs can include persistent jaundice, dark urine, and unusually pale stools during the first weeks after birth. At 7 weeks old, Cooper underwent what the reporting describes only as his first operation. The published accounts do not identify that procedure by name. The standard initial surgery for many babies with biliary atresia is the Kasai procedure, which attempts to create a new route for bile to drain from the liver into the intestine, but it would be an assumption to state that Cooper definitely underwent that exact operation without his records or a clinician's confirmation. Whatever procedure was attempted reportedly did not succeed sufficiently, and Cooper received his first liver transplant when he was 11 months old, in 2002. That sequence is consistent with the broader treatment history of biliary atresia. The National Institute of Diabetes and Digestive and Kidney Diseases says doctors commonly begin with the Kasai procedure, but most patients eventually require a transplant. Even with early treatment, approximately half need a new liver by age 2, while about 2/3 require one during childhood. The first transplant reportedly allowed Cooper to survive and reach adulthood, but it did not end his need for specialist care. Public reports say complications began in 2014, when he was approximately 13, although they do not describe what those complications were. The reporting does not say whether he experienced rejection, bile duct problems, infection, progressive graft dysfunction, or another transplant-related issue. Those are all medically distinct possibilities, and none should be assigned to Cooper without documentation. By 2023, Cooper had reportedly been placed on the waiting list for another liver. That means the difficulties did not emerge without warning in 2026, even though the visible change in his appearance may have seemed sudden to people around him. The timeline indicates that specialists had already determined years earlier that another transplant could become necessary. What the public record does not show is how his liver function changed between the first complications in 2014 and his placement on the transplant list 9 years later. Then came the development that made the seriousness of his condition visible. In January 2026, approximately 24 years after his first transplant, Cooper became dramatically more jaundiced and was rushed to Queen Elizabeth Hospital in Birmingham. His mother, Carrie Cooper, said he had already appeared yellow for a period of months, but that the color became much more intense while he was hospitalized. That account adds nuance to descriptions suggesting that the entire change happened in a single night. The deterioration may have appeared sudden, while the underlying jaundice had reportedly been developing for longer. Cooper compared his appearance to a character from The Simpsons, using humor to describe a symptom that had become impossible to hide. He also acknowledged that the attention made him uncomfortable and self-conscious in public. His mother said strangers stared whenever the family went outside for air, while the whites of his eyes had also become visibly yellow. Medically, the change was jaundice. Jaundice occurs when bilirubin, a yellow substance produced as the body processes old red blood cells, accumulates in the bloodstream and tissues. It can turn the skin and the whites of the eyes yellow. In adults, new jaundice can indicate a serious problem involving the liver or bile system and requires urgent medical assessment. In Cooper's case, the published account connects the bilirubin buildup to the reported failure of his transplanted liver. No laboratory results have been released, and neither the hospital nor his transplant specialists appear to have issued a public medical statement explaining the mechanism. The images document severe jaundice, while the explanation of liver failure comes from Cooper's account as reported through Kennedy News and other outlets. That distinction prevents the story from being oversimplified. Jaundice is a symptom, not a diagnosis by itself. It can occur for multiple reasons, including diseases affecting the liver, bile ducts, or blood. For Cooper, it was reportedly an outward sign that his existing liver condition and transplant history had reached a critical stage, but the specific medical pathway from his earlier complications to graft failure remains private. Cooper remained in the hospital for 5 weeks. His mother said he was transported urgently to Birmingham and that the family feared he might not survive, especially while he was in intensive care. Public reporting places his second liver transplant on February 28, 2026. No information has been released about the donor, the surgical details, or the particular urgency status under which the organ was allocated. A liver transplant is a major operation in which the diseased organ is removed and replaced with a donor liver. NHS Blood and Transplant says the procedure commonly takes 5 to 8 hours, depending on its complexity, and requires significant monitoring afterward. A second transplant can present issues different from a first operation, but Cooper's surgeons have not publicly discussed the complexity of his case. Cooper described the pain after surgery as severe. He also said that he had to learn to walk again, indicating how much strength and mobility he had lost during his illness, hospitalization, and recovery. The reporting does not provide a rehabilitation assessment, so it is unclear whether his difficulty walking resulted from prolonged hospitalization, muscle loss, surgical complications, time in intensive care, or a combination of factors. After a major transplant, patients are encouraged to begin moving as soon as their clinical team considers it safe. Early activity can reduce complications such as blood clots and support the gradual rebuilding of strength. That is general transplant guidance, however, and should not be treated as a description of Cooper's individual rehabilitation plan. The visual change after the operation was striking. Cooper says his skin returned to its normal color, which is consistent with bilirubin levels improving when the underlying liver or bile flow problem is successfully treated. A normal appearance does not mean that transplant care is finished. His ongoing appointments and medication are part of protecting the new organ and detecting complications early. Cooper says he now returns to the hospital approximately every 6 weeks. His exact tests have not been disclosed, but regular blood monitoring is standard after liver transplantation. NHS Blood and Transplant explains that clinicians check immunosuppressant levels because too little medication can increase the risk of rejection, while excessive levels can increase side effects. Early signs of rejection may also be detected through routine blood tests before a patient notices obvious symptoms. He also says he will need medication for the rest of his life. That is consistent with transplant guidance. Immunosuppressant drugs reduce the chance that the immune system will attack the donor liver. Doses may decrease over time, but some immunosuppression is generally needed for as long as the transplanted organ continues to function. These drugs can increase vulnerability to infection and require careful monitoring, which is why patients should never change or stop them without guidance from their transplant team. The reporting does not identify Cooper's medicines, and it would be inappropriate to guess. Different transplant centers use different combinations, doses, and infection prevention treatments. His statement about lifelong medication describes the continuing responsibility that follows a transplant, not evidence that his recovery has failed. The newest public update is encouraging but limited. Cooper says he is back on the mend, his skin color has normalized, and he is grateful to be alive. He is sharing the story to raise awareness of biliary atresia and what he experienced before and after the second operation. As of August 1st, no new or verified statement from Cooper, his family, or the hospital was located after the People report was published. His recovery also places attention on something the more visually dramatic headlines can overshadow. A transplant was available when his condition became critical. Every successful transplant depends on an organ donor and, frequently, a family making a decision during an extremely difficult moment. NHS Blood and Transplant says thousands of lives in the United Kingdom are saved or improved through living and deceased donation, while many other patients still cannot receive an organ because a suitable match is unavailable. The start line takeaway is that Cooper's yellow appearance was not the disease itself and should not become the entire story. It was a highly visible warning sign in a medical journey that began when he was a newborn, continued through a transplant before his first birthday, and eventually led to another transplant at age 25. What changed in 2026 was not simply his skin color. His long-standing transplant complications reportedly progressed to the point that his first donor liver could no longer support him. The jaundice revealed that decline outwardly, while the second transplant addressed the underlying organ failure. Viewers should also avoid drawing conclusions that the reporting cannot support. There is no public evidence explaining why the first transplanted liver failed. The articles do not say that Cooper missed medication, caused the failure through his behavior, or experienced a particular form of rejection. His clinical records remain private, and none of those explanations should be attached to him without evidence. The exact infant surgery, the nature of his complications beginning in 2014, his laboratory results, the reason his original transplant deteriorated, and his long-term prognosis after retransplantation have not been publicly disclosed. What is supported is that he was born with biliary atresia, received a liver at 11 months old, joined the transplant waiting list again in 2023, became severely jaundiced in early 2026, and underwent a second transplant on February 28. For now, the clearest update is that Kieran Cooper has survived the medical crisis, his visible jaundice has resolved, and he remains under regular transplant follow-up. His story is not merely about looking like an animated character. It is about living for more than 2 decades with a childhood liver disease, confronting the failure of a transplanted organ, and beginning again with a second chance made possible by donation.